My name is Dawn, and in 2015, I was diagnosed with stage 1 ovarian cancer. And I often say that I'm the luckiest unlucky person in the world. And I say that because I was really lucky to find ovarian cancer as early as I did, which is why it ended up being stage 1 initially. I would hang out with my daughter on the couch watching TV in the evenings, and she would put her head on my stomach, and it was just becoming increasingly uncomfortable, and I thought something was wrong. So I went to my doctor, and she said it's probably nothing, and had an ultrasound and figured out that actually I had a cyst on my right side, but when they were investigating, they actually found a tumor on my left side, which was a surprise to everyone. So a couple months later, I had surgery, I had a full hysterectomy, and went straight into menopause and then straight through 6 rounds of chemotherapy. I lost all my hair. I was considered cured or recovered after that, which was great. But every 6 months, we would get a scan, which was horrible because it's called scanxiety, and you just never know what they're gonna see on the scan. And 2.5 years after my initial diagnosis, I got the diagnosis of recurrent or metastatic ovarian cancer. After the therapy, the chemotherapy, I still had a tumor. And it had shrunk, but it hadn't gone away. So I think the hardest part of having a recurrent metastatic diagnosis is the uncertainty for how long I have. And I remember that when I was diagnosed with the recurrence, my twins were ending 8th grade, and I couldn't make it to one of their graduations. I really struggled with that because I felt like that might be my last children's graduation. So then I gave myself a good talking to and decided that there was no way I wasn't gonna make it to the next graduation, which will be high school. I think that some of the challenges that I've faced have been getting people to treat me as an individual instead of a typical ovarian cancer patient. And I think that individuality is really important. You know, I'm a behavioral scientist, and I think that an N of 1, or one person, is different than everyone else. And I really feel like I'm unique and my cancer is unique, but at some point you run out of the treatment of choice, and it's kind of a race against time. And I feel like I need to have something else up my sleeve so that I can continue. And I would really like to kick this disease, and I'd love to be able to say that I'm actually cancer-free. I think one of the benefits of working with SOTERIA is that they don't exclusively treat one type of cancer. And so they're able to look at clinical trials that are going on and can maybe see that something that worked in this situation might be a good choice in my particular situation. It's nice to have someone else to have a sounding board with that is really keyed into what is going on in a cutting edge, scientific, state-of-the-art facility, both here in San Diego and again, nationally or internationally. One of the reasons that I think it's important to work with SOTERIA, both for myself and for other people who may not be in the position that I am, is to find access and gain enrollment into important clinical trials and any sort of advanced therapy that exists currently. But it's really hard to do without donations, without financial support. So one of the things that I think is really important, it's the summer of 2020 and we are in the middle of a pandemic, and my concern is that cancer doesn't stop for COVID. There are a lot of people who need treatment, they need access to clinical trials, drugs need to be developed, but everyone, rightly so, is focused on finding a COVID vaccine, and charitable donations are going towards companies that are working on COVID treatments. But cancer needs treatment as well. And I think it's really important that we keep advancing the scientific knowledge of these diseases.